I am Dr. Aurobindo Mukherjee. I am Professor of Neurology and Senior Consultant of Neurology at the Calcutta Medical Research Institute, Calcutta. Today I will discuss about the facts and figures of epilepsy, which is a common malady. This month being the purple month, which means that this is freedom for all epileptic patients. I would like to send across the message to all epileptic patients that epilepsy is a treatable condition, and even with this chronic disease, people can have normal life, including normal job, normal marriage, and normal social activities. To start with, I will discuss what we mean by the word epilepsy. Epilepsy is derived from a Greek word, and it is characterized by recurrent increased electrical activity of the brain, which manifests itself by the clinical feature of recurrent loss of consciousness, sometimes with violent involuntary motor movements, throwing of limbs, shaking, etc., or sometimes it may be only the altered senses and loss of consciousness. If we come across the different types of epilepsies, there are different types. We can group them according to the manifestations we see. Some of the common epilepsies are tonic-clonic seizures, where the people have loss of consciousness associated with violent muscle movements. In other extreme condition is the absence seizure, where there is only momentary loss of consciousness without any motor movements, and which usually affects the children. There is another type of epilepsy which is called myoclonic epilepsy, where the people have sudden jerks. Usually they drop objects frequently, and it is sometimes looked upon as clumsiness of movement, but those are actually myoclonic epilepsies. We can characterize epilepsy according to the causes also. In majority of the causes, we don't have any brain dysfunction or brain disorder associated with epilepsy, so we call them idiopathic epilepsies, and they constitute about 50% of all cases. If we see the incidence of epilepsy globally, the incidence is about 2 to 3 per 1,000 population. So we know there is a large number of epileptic patients. As I just told, that there is a group of patients who have no dysfunction in the brain. They are called idiopathic epilepsies, and sometimes the epilepsy may be a manifestation of some brain disorder, which may include infection, brain trauma, stroke, and in children some birth injuries or developmental defects. We group them as secondary epilepsies. So once we come across an epileptic patient, our duty in the first phase is to establish the diagnosis. The diagnosis is done mostly clinically from the history and the experience of the eyewitness, like parents or the spouse, etc. And in some cases, we'd go for some investigations like electroencephalogram, which is the recording of the electrical activity of the brain by a machine. And according to the electroencephalogram, not only we can diagnose epilepsy, but we can also classify epilepsy in primary epilepsies, secondary epilepsies, and which part of the brain the epileptic focus is actually occurring. In very selected cases where we suspect that the epilepsy could be a manifestation of brain tumor or brain infection, particularly in our country tuberculosis or some parasitic infection like neurocysticercosis, we advise brain imaging, preferably MRI scan of the brain. And next stage, when we are confirmed that the patient has got epilepsy and he needs treatment, then our task is to find out which suitable anti-epileptic drug is good for that patient. Today, as we have got an option of at least more than 15 anti-epileptic drugs, but the choice of drug may depend upon several factors. The most important factor is what is the type of epilepsy. Like if we are treating with the generalized tonic-clonic seizures, maybe we will choose one group of drug. Whereas if we treat or we have come across a absence seizure or myoclonic seizures, then we will treat with another group of anti-epileptic drugs. So classifying epilepsy is the most important factor regarding the choice of the anti-epileptic drug. Once we classify epilepsy, then we have to take into account several other factors like age of the patient, like some drugs are good for children, some drugs are good for adults. Then we have to also know the sex of the patient, because certain drugs are not very good or not ideal for treating epilepsy in women in the childbearing age, because they have got some hormonal effect and some negative effect on the offspring in case the woman with epilepsy becomes pregnant. And also we have to take into account the cost of the drug in our country and the availability of the drug. So because all these factors lead to the compliance of the patient, by the word compliance I mean that patient is taking his or her drug very, very regularly, because that is the main important point for good treatment or successful treatment of epilepsy. Now, with these anti-epileptic drugs, it has been seen in worldwide that more than 70% of the epilepsies can be controlled by one or two anti-epileptic drugs. In rest of the 30% patients who cannot be controlled by trial of anti-epileptic drugs, there are other ways of treating. The important method of this drug refractory epilepsy treatment is the surgery. Now, epilepsy surgery is being developed worldwide, and they are giving good success to a limited number of patients who can be decided by different investigations who are the good candidates for surgery. Even those patients where surgery cannot be done, we have got other methods, like we have got access to nerve stimulation like vagus nerve stimulation, or some dietary modification like ketogenic diet, which is also which make treatment successful in so-called drug-resistant epileptic patients. Now, there are certain do's and don'ts of the epilepsies. We always say that the person with epilepsy should have normal activities, normal job profile, but certain things are prohibited, like they should not be allowed to drive, and they should not be allowed to have any water sports because of the chance of accidents. They should not be left alone near the fire. And number 4 is that they should have adequate night's sleep. And 5th, which is the most important, that they should take their medicines regularly. Except for that, regarding other sports activities, other job activities, and other recreational activities, the epilepsy patients can do it normally as compared to the other normal populations. Regarding marriage also, now there is a clear instruction that the epileptic women can marry and have children under good supervision of the obstetrician and the neurologist or the epileptologist, and therefore the so-called stigma that the epileptic women cannot marry and have family is totally not acceptable in these days. With this, I think with our message, take-home message will be that epilepsy is a recurrent disorder, and if we can diagnose it correctly, we choose our anti-epileptic drugs correctly, taking into account the seizure type, the age of the patient, the sex of the patient, and if the patient is compliant to the medicines, then probably in about 70% cases this is totally controllable disease, and they should not have any stigma or any restriction for going for normal life activities, including women with epilepsy who should have normal married life and can bear children under supervision of the neurologist and the obstetrician together. Now I like to tell you what to do when a patient is actually having an epileptic fit. The first and foremost thing, the family members or whoever caregivers are nearby, they should not panic, because epileptic fits in most of the cases terminate by itself. The only thing we have to do is that we have to see that the person does not injure himself or herself. For that, he should be protected against any sort of injury, but forceful restraining is not very advisable. We definitely prohibit putting any hard object like spoon or the finger of caregiver in between the teeth, because in that case the teeth may get injured. So the best thing is to do is to turn the patient to one side in the prone position or semi-prone position and put some soft object like a towel or handkerchief which is available nearby in between the teeth, so that there is no tongue injury or tongue bite. And then we should keep the rooms open so that enough oxygen is there, and we should be careful that the person is not, if he has vomited, is not aspirating the vomiting. By these simple measures, most of the fits are terminated by itself within 2 to 3 minutes. But if the fits prolong for more than 5 minutes, then we should be very careful, because we designate them as status epilepticus. In that case, the urgent hospitalization and institutional care is mandatory.